everyone, Dr. Lachman from Cool Dental. I want to show you a model. This is a model printed from a CT scan of an actual person to give everyone a sense for how tall the jawbone is where you have teeth, okay? So this is when someone has a well-developed jawbone. This is normal size of someone's lower jaw. What most people don't realize is if you pull a tooth, within the first year, you're going to lose about 3/4 of the width of the jawbone. The jawbone starts to shrink this way, okay? And then over the next several years, the bone starts to shrink in height. So for people who are missing many teeth, they are usually losing and missing much of the jawbone, okay? Now this model is someone who's been missing teeth for more than 10 years, okay? I want you to notice how thin it is this way, but also how short it is this way. All of the bone that used to hold the roots of the teeth is now missing, okay? And that is why people who wear dentures, usually the first year or two they get by okay, but as the bone loss continues over time, the pink part of the denture gets thicker and thicker and thicker as the bone gets thinner and thinner and thinner. So you can see the longer you're wearing dentures, the less bone you have, and you need bone to support the denture. So if the denture doesn't have a lot of bone to rest on, if it's really flat, there's nothing to support it, and that's when people start having problems because the tongue is right here, and every time you talk, your tongue is moving, which means now the teeth start to move with it, and every time you're chewing, the tongue is moving, and it takes your lower teeth with it. So this just gives you a visual of how much bone people are missing when they've been wearing dentures for more than 10 years, okay? Very helpful if you can keep and maintain your own teeth. Whenever a tooth has to be lost for whatever reason, if it cannot be saved, best time to get an implant put in is within the first year before the bone loss starts to creep up on you. We can always regrow the bone if we have to. That just gets expensive and more procedures. So it's always best to keep the bone that you have rather than try to regrow it years later. Thank you.